Hello, my name is Dr. Danny Sands, and I am an assistant professor of medicine at Harvard Medical School. I'm also an attending physician in primary care at Beth Israel Deaconess Medical Center in Boston. In addition, I'm a co-founder of the Society for Participatory Medicine, and I'm the Chief Medical Officer of Conversa Health and Kinergy Health. I think in South Korea, you have tremendous potential for the use of information technology. This country has been a leader in technology innovation, and incredible minds have gone into developing tremendous technologies in the consumer space. However, I believe there are also tremendous opportunities in the healthcare space. I think that probably the opportunities would be advanced if there were a different emphasis in healthcare. So if we could move the healthcare system to a system in which we are paying doctors not just for seeing patients and more patients, but we should actually be paying doctors for high quality outcomes at lowest cost. And if we had accountability for the outcomes and we were paying for high value care, then that would encourage physicians and hospitals to really practice in a very different way. And I think that it would really encourage the use of health information technology. In South Korea, we have such a strong consumer market. Consumers are doing amazing things here, really in advance of most of the world. And they're being enabled by some of these amazing technologies that are being developed here. I think that the next step in that is for consumers to be involved more in their health care and to really take an active role in their healthcare, partnering with their healthcare providers, their doctors and so on, in managing their conditions over time. This would include accessing medical information online, accessing other patients online, taking better care of themselves, and even demanding access to their own health information. So when you go to the doctor and you get a test done, for example, you should have access to those test results immediately. Those test results should be available to you online. You shouldn't have to see your physician. Your physician shouldn't have to give you permission to get those test results. Those test results, and in fact, your entire record should be available to you. If we want patients to take an active role in their health, we need to provide them with the information tools that they need. Part of that information is knowing about their illness and conditions, but part of it is actually having access to their own personal health information, access to their medical record. So as we think about engaging consumers in their health more, I think that part of that's going to come from just an awakening of all the information that's out there, providing access to their health information. But I think that there needs to be a change of mindset of the healthcare providers as well, so that doctors are encouraging their patients to access information. We should be asking, doctors should be asking at every visit or every year, we should be asking our patients, are you going online to look for health information? When our patients become ill, we should say, there is some information you can look at online, or here's a support group that you can go to that might help you in managing your condition. I think in ways like this, we can encourage patients to go online, but if doctors are going to be resistant to that. That is, if doctors are not going to be happy with their patients going online, then it's going to be a problem, because patients are still going to be going online, but they're not going to be telling their doctors about it. And that leads to a problem, because then we're keeping information from one another. We're not having honest disclosures. So I believe that if we have a change of mindset in the healthcare professionals side as well as the patient side, I think it will really help to improve the healthcare outcomes and improve the efficiency of the healthcare system.